Hi everyone, this is Dr. Nyla, and I have put together a really quick overview on pediatric oral health. The first area that I'm going to touch on is teething. Teething is a normal part of growth and development, but this phase can be very distressing to parents. Parents will look to you as an expert, and it is our job to be prepared to answer lots of questions and provide anticipatory guidance to our parents. Children do not have the ability at this age to communicate their pain or their needs, so parents may come into your office and be extremely worried about their children. So it's important that we're ready to talk about teething and tell our parents what to expect. Common symptoms of teething will be a fussy infant. There may be a lot of drooling with these infants. Things that we can teach our parents to do is to treat them supportively, and that means applying cold washcloths to their gums, um, cold teething rings. The rubber teething rings are also helpful. We want to discourage the use of topical anesthetics, and there are many home remedies that parents may have. We need to listen to them with open minds, but listen for things that could potentially be very dangerous for our patient. And what comes to mind is applying alcohol to gums. That is something you definitely want to discourage parents from doing, but make sure that you listen in an open manner and you convey your message without being offensive to the parent. Parents will want to know when to expect teeth. And parents will also have the tendency, which is very natural, to compare their children to other children that they've known. It's important to make sure that our parents are aware that there is variability in growth and development of children. So some children will have teeth at age 6 months, others will not. But parents should expect the first teeth between the ages of 6 to 8 months, and teeth will be done erupting by 30 to 36 months. And as you look at those numbers, just recognize that there is a range of when to expect these teeth. I've also included a baby teeth chart, which gives the typical order of eruption of teeth. Childhood is such a magical time, not just for the child, but also for the parents and the grandparents and family and friends that are involved with the upbringing of the child. So they will want to know when to expect the tooth fairy. The tooth fairy can be expensive for some people. So tell parents that they can expect that their child will begin to lose teeth around the age of 6. And around that time is when they should expect the permanent teeth to erupt. Remember that this is not a competition. Some children will lose their first tooth at age 6, others may lose it at 7, but that is completely normal for that spectrum. Just remember there is variability for teething. We need to teach our parents and our children how to care for their teeth. Cavities or dental caries is the most common chronic childhood disease in the United States. That's a big deal. So that means we have to take time with each visit to teach our parents and the kids how to manage teeth. Cavities are caused by bacteria, viruses, and fungi. If cavities are not treated, children will develop pain, they can have infections, they will have problems eating, speech problems can occur. Dental caries also interfere with learning, playing, and these children miss more school than children that are not suffering from caries. Dental care should begin early. So even before patients have teeth that are erupting, we should still be caring for the gums. So infants should have their gums wiped twice daily. A recommendation could be once in the morning after their first feeding and then again just before bed. Once the teeth start to erupt, you want to brush the teeth twice daily. There's small, soft, bristled toothbrushes that are made specifically for infants. We want to use toothpaste. And fluoride is okay, but it needs to be a very small, like rice-sized amount on the toothbrush. And we also recommend getting a flavor that the children will like. So a lot of kids won't like the mint flavor, but they do have like strawberry flavored toothpaste for children. They should see their dentist by the first birthday, and we don't want our children to have a bunch of sugary drinks. So we want to do everything that we can to keep our babies from developing dental caries. The same thing applies as the children get older. We still want to encourage brushing twice daily with fluoride. The amount of toothpaste on the toothbrush will increase because the child is bigger. So a pea-sized amount is great in childhood. Seeing the dentist on a regular basis is also helpful, and we want to make sure that we are not consuming a bunch of sugary drinks. Even with the best precautions, there are some children that will still develop dental problems. So if a child comes in for dental pain, we would recommend analgesics. So things like Tylenol would be helpful for the child. If the child's able to rinse their mouth with warm water or salt water rinses, that will be helpful. And also consuming a bland diet. So things that are not going to irritate the gums further. If the patient develops an infection, you would want them to follow up with a dentist, but we were able to start them on an antibiotic. And the same thing with dental pain. We will do the supportive care, which is start the pain reliever, do the rinses, but you have to ultimately follow up with a dentist to get to the root cause of the problems many times. If the patient develops a dental abscess, we can get them started on the antibiotic, but it's something that has to be managed by a dentist where they may perform a surgical drainage of the abscess. But again, the big thing is that you got to follow up with a dentist when you have these types of things. We can also prescribe medicines such as chlorhexidine to rinse their mouth. Using this on a regular basis can have an antimicrobial effect for the patient. So that covers some of the highlights from our section on dental care. There will be more information about the remaining information on the module available to you in the course. And again, if you have questions, as always, I am available to you. My information's in your course. You can reach out to me at any time. All right, good luck with your